Now that you have understanding of taking X-ray images, we will focus our attention to the diagnostic ultrasound machines. Unlike the X-ray study, you will not be responsible to perform the ultrasound study on a patient. Your job will be merely to set up the machine so the physician is ready to perform the study when they enter the room. In Centralia, you will find the green diagnostic ultrasound machine in the back of the hallway, near the surgery site door. To use this machine, roll it to the room you will need it in. Plug the unit into the wall with the unit at the foot of the chair, turned sideways enough so that the physician and the patient can see the screen. When plugged in, you will flip the green power switch to the on position that's located in the back of the machine and press the button that allows the keyboard to pull down. When the keyboard is down and the machine has loaded up, you will press the ID button in the top left corner. This will allow you to type the patient's name into the machine. Type the last, followed by the first name of the patient, and press the Enter button, which looks like a bent arrow to the left. You will need to make sure there is a full bottle of ultrasound gel there. It should be already on the machine in the basket or shelf under the machine. If there is not, each room should be stocked with ultrasound gel in the cupboard above the sink or to the side of the sink. Make sure you remember where the gel came from and put it back. If the machine comes without any gel, you will need to secure a bottle of full ultrasound gel to place on the rack on the machine. The patient is now ready to see the doctor. When the study is done, the doctor will have printed off the images he captured. You will need to make an X-ray jacket for each of them. Each room should have a chart holder outside the door with X-ray jackets located in them. Print the name of the patient, the date, and the doctor along with the images obtained. Then place the ultrasound print into the jacket. If you do not get this accomplished right away, the scribe will place the loose studies in an area where you can get to them and do this later. The diagnostic ultrasound machine in Tumwater is a little different than the one in Centralia, although it serves the same purpose. There are more steps involved to setting this machine up. At the beginning of the day, the ultrasound machine will already be plugged in at the hall near the side entry door. It's imperative that this machine stays plugged in at all times because it has a backup battery system. When the machine is unplugged, there will be an annoying beep that follows until the machine is plugged back in. So, if unplugged, it should only be unplugged long enough to wheel it to the room and then plugged in right away as soon as it enters the room. Likewise, when exiting the room, you'll unplug it only long enough to plug it back in when you set it back in the hallway where it belongs. At the beginning of each day, you'll need to turn on the machine right away because its warm-up process is very lengthy, and it is better to start at the beginning than at the first patient, which will take longer to see the patient. To turn it on, you will flip the switch located on the tray under the machine on the left-hand side. It is a green switch. When the machine is turned on, it will take you to the patient registration window. When ready to set up a diagnostic ultrasound for a patient, you will wheel the machine into the room, take care to carefully unplug the machine, and then plug it back in the room. Situate the machine at the foot of the chair so the physician and patient can both see the screen. Enter in the patient's name, last and first, and the doctor name. Press Enter, and you'll be ready for the doctor to do the study. When the study is complete, again, the physician will have printed off the image and you will need to make a jacket for them, like mentioned before. To prepare the machine to see the next patient, you will press the Start End button at the top left of the keyboard. It will ask if you want to end the study. Press Enter. You will then be taken to the patient registration screen to load the next patient info at a later time. Wheel the machine carefully back to its place in the hallway and plug it back in. It will do an annoying beeping, as mentioned before. At the end of the day, when you no longer need the diagnostic ultrasound machine, you will need to turn it off. To do so, you will press and hold the Start End button until the screen prompt shows up asking if you want to turn off the machine. Press the Enter and wait as it does its long shutdown process. When it is complete, it will prompt you to flip the power switch to the off position, and you're done.